So thank you for taking the time to meet with me. I appreciate it.
Sure thing. I'm glad to.
Can you tell me when you went through the 12-day course?
Sure. January 15th is when I started. Somewhere that week of January is when I started. So it's been about 6 weeks, 6 months now.
Great. Can you
Yeah.
tell me how your life has changed since going plant-based?
Oh, well, so I have to say I've been vegan most of my life. There was a few periods where I was vegetarian. I've always been plant-based, but certainly not whole foods and totally not starch heavy, or starch based for sure. And so looking at that, I would say so many things have changed for the better. From a health perspective, I was had metabolic syndrome. A1C was elevated. I had started taking metformin. I wasn't diabetic, but pre-diabetic. Long since I started the program, I had stopped the metformin, which I was always nervous about taking. So my last A1C was 5.5, which is with the normal limits, which is really, really good. I would say that actually my life is much, much simpler, from food prep to buying food. And I have a chronic illness, so that's very important to me, and is one of the reasons that I would eat a lot of processed food, just from a simplicity standpoint and a speed standpoint. There's nothing easier to me than eating the McDougall way, because I keep things super simple. I don't do recipes. I've tried to do one or two, and from your cookbooks, and they're great, but I feel like I do the best when I'm super simple. I have lost considerable weight and continue to do so. I've lost about 28 pounds. I have some more to go, but the big chunk, I think, was kind of the hardest part for me. The other thing that's changed is I'm not food focused all the time. Before, didn't matter how I was eating, or what of the many diets I was on. I was always thinking about my next meal, my next snack, my next sugar fix, my next, even if it would just meant grabbing sugarless gum and ruining my gut by chewing that to get me through. I was always focused on that sugar fix. And now I have cravings every now and again. And with Tiffany helping my support specialist helping, I've learned how to work through those. So it's really, really not an issue. So I would say my life has significantly changed.
That's great. It sounds like you're really making the most of the program.
Yeah.
You
Yeah.
learn, even though you were already plant-based, there's
Yeah.
so many things that you can change. And
Oh, yeah. No,
plant-based can be Twinkies and Diet Coke,
that's
right?
right. That's right. The other thing that changed, and it took a while to change, is with the chronic illness that I have a lot of inflammation. So I always have tendinitises and all kinds of, arthritic issues and stuff that come from it. And I had scheduled to have a tendon release in my thumb, because I'd had as many cortisone injections that I could. And I decided, once I started with the McDougall program, to put that off. I have no problems. And that took about probably the fifth month mark. And I kept thinking, well, some of my other joints are better, and then just sticking with it. I have, maybe in the mornings when I get up, I have a couple joints that might be a little stiff. That's the worst of it. So
That's great. That's
big,
so
big
great to
difference.
hear. In just 6 months too. That's
Yeah,
wonderful.
no, that's right. And I have tried every kind of health intervention. I've done hundreds of like hyperbaric chamber sessions, and worked with all the lots and lots of different doctors, and tried all kinds of meds. And the simple starch-based diet is what fixed me. So,
Amazing. So you say you like to keep your meals really simple. Can you
I
tell us
do.
your favorite meals that you throw together?
Usually for lunchtime, I'll eat some vegetable soup, and I will then eat a Japanese or a white sweet potato with just simple, with some, I usually put some chipotle and some cinnamon on it. On the side, I might have Brussels sprouts and broccoli. And I might, every now and then, I've gotten crazy and made some of your cheese sauce. But usually I just eat it plain. It took me a while to get used to, but now I like it just as much, if not better, than eating it all sauced up. And then at dinner time, I'll usually eat a big salad, some brown and black rice mixed together with a stir fry type. I don't fry it, of course, but like a stir fry vegetable on top. And maybe I'll sprinkle, like some sort of Asian like amino acids or something on top. And that's pretty simple. Then before I go to bed, because I'm always hungry to go to bed, I'll eat a piece of fruit and we're done.
You're taking all the principles we taught you and
Yeah.
really making them work for you. So that's
Yeah,
wonderful.
I'm very, very, very happy.
Is there anything you'd like to share before we sign off?
If you can name a celeb doc or a celeb diet, I've done it. This is by far the simplest, the most effective, the most satisfying way that I've ever eaten. And right from the beginning, I felt like, okay, I can do this the rest of my life. Like this really is my preferred way of eating anyway. And I would say that the course I thought was super beneficial. I don't know that I would have been as successful just reading the books and listening to some YouTubes. And the other thing that I have found surprisingly successful is the continual follow-ups with Tiffany. She's just a wealth of information and gets me back on track if I don't usually go off the track like eating extra stuff, or I start to try to hack it where I try to outsmart and like lose weight quicker, because I got really greedy at first. I was like, I don't care how much weight I lose. And then once I saw, I was like, oh, now I'm really greedy. And so she'll help get me back on keeping the very simple and the basics and trusting the program. So
thank you so much for sharing, Susan.
sure.
I appreciate it a lot.
Yeah, no, I appreciate all of y'all's help, and really doing all the follow-ups that you offer is very beneficial. So thank you.
Great. I'm so glad you're taking advantage of all of them. It's great to hear.